In the last video, we talked about the beginning stages of our anesthesia workstation. We talked about our pipeline sources of oxygen and nitrous oxide, and we talked about our E-cylinder sources of oxygen and nitrous oxide, and how we wanted to preference the pipeline source first. And the way that we do that is we decrease the pressure of our E-cylinders using a pressure regulator so that you have a higher pipeline source, and that can be preferenced to flow towards the patient. Now we are going to continue talking about another pressure regulator that further decreases the pressure of these gases, which is called the second stage pressure regulator. I just drew it on the oxygen side. And the reason why we have this is because even though we're using pipeline oxygen at a pressure of 55 psig, that's still a pretty high pressure to administer into our patient's lungs. So what this second stage oxygen pressure regulator does is it's going to decrease that pipeline oxygen pressure from 55 psig all the way down to about 14 psig, which is about 1 atmosphere. So this is way more friendly to deliver to the lungs as it's going to make its way to our patient. So as the gas begins to reach the final portion before the patient, we have to have a way of controlling how much gas we want to give, how much of that fresh gas flow we want to give. So we need some flow meters, which are located right over here, that allow us to regulate the amount of nitrous and oxygen that we give to our patient in liters per minute. So we have flow control valves that regulate how much oxygen. We can give 2 liters a minute of oxygen, we can give 8 liters a minute of oxygen, and we have to have a way of controlling that. So we have our flow control valves going through our flow meter, and as it makes its way towards the patient, we have our anesthetic gas that the fresh gas picks up and drives and carries towards our patient. So one thing to note is that our oxygen flow meter, if you can see here, this is our oxygen flow meter. This is our nitrous flow meter. As you can see, it's connected to the nitrous part. Our oxygen flow meter is always the closest to the patient. And the reason why we have that is in case we have a leak in our flow meter system, we do not want that oxygen gas to escape. We want the oxygen to be as close to our patient as possible. So the next thing that we have, speaking of having a hypoxic mixture, is that we have this oxygen flush valve, which you can see there's a little gap right over here. We have an oxygen flush valve, which is located in our illustration right over here, and that allows direct communication between the oxygen intermediate pressure circuit, which is located around where our pipeline pressure is at 55 psig. So it allows direct communication between the oxygen intermediate pressure circuit and the low pressure circuit, which is where we are connected at 14 psig of oxygen. So this flow from our oxygen flush valve enters the low pressure circuit. As you can see, it's bypassing our flow meter, our oxygen flow meter. So there's a specific flow at 35 to 75 liters per minute administered to the breathing circuit. And then the last thing that we have is an oxygen supply failure alarm, which is located right over here. This oxygen supply failure alarm, which senses low concentrations of oxygen. If there are low concentrations of oxygen, then that will signal the fail-safe valve, which is located on our nitrous side of the circuit, to shut off the supply pressure for all other gases. And that will allow us to preference oxygen, and it will avoid us administering a hypoxic mixture of gases. So as you can see here, we have varying stages of different pressures of gas throughout this circuit or throughout this workstation. We can divide them into high pressure circuit, low pressure circuit, and intermediate pressure circuits. So our low pressure circuit is going to be where our pressure is around 14 psig, and that is towards our patient. That keeps it friendly for our patient's lungs. The high pressure circuit is going to be where our E cylinders are at 745 psig for our nitrous, at 2200 psig for our oxygen, and where the pipeline comes in until the area before we transition the pipeline to our 1 atmosphere or our low pressure system. That is our intermediate pressure circuit. So this is a complicated video. I would love some feedback on how I can make it better and easier for you to understand. Essentially, just to quickly review, we have our pipeline sources, we have our E-cylinder sources. We need to decrease our E-cylinder sources in order to preference our pipeline sources and only use our E-cylinder for emergencies. We do that using a series of check valves to ensure one-directional movement, unidirectional movement, pressure gauges to know the pressures, and pressure regulators to decrease those pressures to preference our pipeline. At the same time, we need ways to make sure that we can detect decreased oxygen concentrations, and if we do that, then we can shut off all other gases to be delivered to our patient to avoid our patient from becoming hypoxic. We have to have a way to continue to decrease that pressure to be friendly to the lungs, and once we do that, then we can regulate how much of that gas we can administer through our flow meters and through our flow control valves. And then once we get past that, we can carry some vaporizer, some anesthetic gas, and be delivered to our patient. Our flush valve allows us to bypass this flow meter system and administer our oxygen without having to go through this extra step.